Allow me to introduce our esteemed group of panelists. First and foremost, Dr. Harsh Mahajan, Founder, Managing Director and Chief Radiologist, Mahajan Imaging. Mr. Joseph A. Nicholas, President and CEO, CTSI. I guess, ladies and gentlemen, we could do with a much bigger round of applause. Let's gain some vibrancy and energy into the room. Thank you. Up next, we have Dr. Gurpreet Vander, Vice Principal and Chief Cardiologist, Dayanand Medical College and Hospitals. Moving on, we have Mr. Rahul Khosla, Managing Director, Max India. And we have our beautiful moderator, Ms. Preetha Reddy, Executive Vice Chairperson, Apollo Hospitals Enterprise Limited. Over to you, ma'am.
Namaste. I've never been called beautiful and ravishing. I think he's being too kind, but anyway, women, I guess, love compliments, so that's fine. It's interesting that I'm among very knowledgeable gentlemen who really know the in and out of healthcare. But the topic is interesting because, you know, there's always this issue of bureaucracy, commerce, and the politics of healthcare. What might have been forgotten is the fact that all of us are literally in the business of caring. And the caring aspect doesn't apply at all that, you know. Healthcare has been looked at as maybe with a lack of trust, maybe as people who are not doing what they have to do. There is the government who really has to give back to the citizens because healthcare is everyone's fundamental right. And there's no going away from that. And then we live in this beautiful country and look at healthcare all over the world and say, my God, Indian healthcare is the worst. And what I'd like everyone to understand that Indian healthcare is actually not among the worst. And many countries have huge problems with giving out healthcare, and they're really not delivering on the promise as much either. So I think that's one change which all of us have to think about. I don't have a prescription for India's healthcare sitting here. What I know is that I have great people on the left and on the right side of me who have a lot of thoughts and maybe some answers. To me, there are a lot of questions in my mind itself when I sit with all of you. And I'm just going to put some of those thoughts up to everyone to discuss in a very freewheeling and possibly a very frank discussion. We did say that when we were talking before we came on, that while a lot depends on the government, today we're not represented by the government at all on this panel. So while we're talking and we're in and out of it, I'd request my panelists to sometimes wear the hat of the government and imagine themselves to probably be the health minister of the country or the bureaucrat of the country, or look at themselves as a politician who has to give out healthcare and come back and tell us what they might like to do and what they're ending up doing. So that may be interesting for all of us. Just some facts that India has 20% of the global disease burden, but only 6 to 8% of share of infrastructure, which means hospitals, personnel, financial access, the whole gamut of it. So we have this huge dichotomy of 20% versus 6 to 8%. We have fantastic centers of excellence among, you know, other, what shall I say, islands of excellence and a sea of dismal locations, dismal outcomes. We want to do medical tourism, but we're not very friendly as a country when tourists really want to come to our country for healthcare tourism. We have a problem there. The healthcare spend, which is out of pocket, is the highest globally. 60% known data where people spend out of their pocket. estimated data is almost 80%. So, that again is a huge eye-opener to all of us. The manpower ratio, again, big problem because we don't have enough doctors, nurses, technicians, allied healthcare workers to really handle the healthcare even if we want to. The interesting thing is funding for healthcare has grown rapidly. We have the banks, we have private equity, we have different financing models for building infrastructure. What we don't have is financial models for people to access healthcare. So again, we have a paradox and a dichotomy here. Are we looking at data capture, analytics to deliver better healthcare? We're trying. I can't say we're not, but we're trying, and we could probably do so much better. We have the largest pharma industry, which is really helping the rest of the world with their medicines, but we don't have the largest healthcare industry, which is looking after the Indians. Again, a paradox and a dichotomy. So to help me really unravel some of these mysteries, we have our great panelists with us. We have Dr. Gurpreet Singh, who's the chief cardiologist at the Hero DMC Heart Institute, a man known for his great integrity and managing skills. We have Mr. Joseph Nicholas, who's the president and CEO of CTSI. Some phenomenal work in oncology, which is going to be happening, and I think we're really looking forward to that. Mr. Rahul Khosla, a good friend who heads the entire Max enterprise on healthcare, apart from chairing their insurance. But more than anything else, I know Rahul as president of Nat Health. So he will wear multiple hats, I'm hoping, this evening, and tell us, what can be done in the healthcare space. Dr. Mahajan, I think India is one of the most trusted radiologists and radiology providers in the country, who's really set the standards and raised the benchmark on, how radiology work has to be delivered in our country. So thank you all, gentlemen, for being here as part of this. I think we should just start off the first question about, how do we deal with this big gap of the disease burden and just our share of infrastructure. And Rahul, I'd like you to just start off the discussion, but please feel free to, just jump in, all of you, and say whatever you'd like to say.
Preetha, thank you very much. Good afternoon. Actually, my response to your question is slightly indirect, if I may. I believe that there is a huge opportunity to bridge what I would call a communication gap amongst the various components of healthcare that need to be delivered cohesively in this country. I feel that the opportunity is around alignment along different segments of the healthcare industry, particularly where public healthcare practices and public healthcare delivery and private healthcare delivery need to work together, because we are in a somewhat unique, perhaps not unique, but somewhat strange situation where 8 out of every 10 rupees that is spent in this country is spent through private healthcare. So access becomes incredibly important, affordability becomes incredibly important, obviously quality is incredibly important. And how do you stitch together a strategy where there are so many fragmented elements trying to do their own thing, and yet the cohesiveness and the orchestration of this in one particular sort of aligned way is far from happening. So my view first is to say we need to create the basis for a dialogue, right, where the government, and to your point, you said that the government is not represented here, and the government needs to, and the private enterprise needs to sit together and actually reconcile what the needs are that the government is operating to. How can private enterprise actually help? How do you remove the barriers of mistrust or distrust and so on and so forth with actual data rather than opinion, and make sure that you at least create the pathway for short, medium and long-term goals which need to be achieved together rather than separately. And I believe that that includes things like policy formation, it includes things like facilitation, infrastructure, funding, medical education, supply side economics, and so on and so forth. So it's a very indirect question and a very broad answer. But without that dialogue, Preetha, I don't think we'll be going anywhere other than making marginal or incremental moves here. That's my view.
I think that's very well said, Rahul. Do you see it happening? Do you see a climate change?
Yeah, it's not a cataclysmic change that I see, but I see the beginnings of the recognition that this dialogue is needed, and I'll tell you why. Sooner than later, and I'll be very blunt, any polity, any political organization or a government or what have you, is going to react when its population it starts voting with its feet. Okay? If you're not going to provide healthcare in a country as vast and diverse as this, you are going to come into a huge problem, not just of productivity, but of actual survival. And my view is that that recognition has started. Equally, on the private side, we have to, I think it is clear to many of us that you have to stop serving your own needs all the time, and you have to actually give a little to get a little. Other than that, it won't move.
Dr. Singh, there's a lot of issues about integrity and healthcare. And the fact is there's a trust deficit between, the government and the private sector. And the fact that this much talked about PPP models are really not happening the way they should be. What are your thoughts on that? And any other thoughts in this whole...
Yeah, maybe if you permit, I'd like to touch upon the disease burden that you initially started with being a physician. We truly are in this country living in a kind of a paradox, because in the stages of evolution, people initially have pandemics and infectious diseases and poverty-related disorders and maternal and child health disorders. And then as economies grow, as nations become more prosperous, they have a burden of non-communicable diseases. But in this country, we truly have a paradox. We haven't yet conquered the communicable diseases. We haven't yet handled the high maternal and child health. A newborn who is born does not live that often till 5 years of age. There is a 7% mortality, which truly is a very high mortality as compared to US, where it is 0.5. So we are struggling and fighting for control of some of these infectious and poverty-related disorders. At the same time, I was reading a report in the New England Journal of Medicine. There's a big study by the name of Pure Study, which looks at the disease pattern of
But do we have solutions? Do you have, the problem is there, it's all over the place. Do we have solutions about how we can tackle this?
The solutions to the Indian context will have to be different from, we cannot adopt anybody else's methods that they have adopted. For the simple reason that our people live, almost 70% of India still lives in the rural areas. And all corporate hospitals, all big hospitals, all for-profit institutions would obviously, and I would say should also, open up in areas where people can pay, because ultimately their viability issue has to be there.
So you're saying there should be a give and take the same way.
So the government has to chip in and see, just like Air India used to fly flights to areas where a private airline would not, the government has to chip in and see which are the, rather than opening big hospitals in large cities, which either way the corporate sector has taken up and government can buy those therapies from them. I think the areas that the government really needs to kind of develop is primary healthcare, which is difficult for a private sector, for a corporate sector. I would say your group now, the Apollo group started in 83 or? Yeah. And it's grown to a volume. It started with a 150-bedded hospital. Today it is something like 10,000 beds. Everywhere Apollo went, there was success in tertiary care, secondary care hospitals. But when it came to primary care, there were some hiccups. It could not be translated. So essentially, it looks like the primary care, if we have to find out, as Rahul was also saying, kind of a collaboration between the government and the private sector. And the hospital that I belong to, it's a not-for-profit organization. Just as you were saying outside, it's a corporate social responsibility. But it's a big hospital. It's a 1,500-bedded hospital. It runs a medical college. It has kind of courses for all
Yeah.
producing doctors. So a mixture of all these three will have to be developed so that the government comes into areas where corporate sector is not ready to go because there are not returns and it would be not viable. And the corporate sectors, either way, we have, I am told some of the Delhi hospitals have health tourism to the tune of 20% of their patients are from in Apollo and all these Max and for. So there is a lot of medical tourism happening, which means the level of care is very high in these institutions. But our basic needs for the rural India, where 70% of the people are living, the disease burden comes essentially from there. And we have to find solutions for that. We are excelling in areas of excellence. Technology is coming. Just now you were telling us outside that some liver transplant unit is coming up in Bombay. So we are developing and evolving into cardiac transplants, liver transplants. But if we need to make an impact on the general health of this country, then the primary care will have to be.
Dr. Mahajan, you are the best person with the, you've tried the PPP model. There's some successes, some failures.
Mostly failures, I think. Yeah.
Well, maybe we can learn from failures.
See, I think, taking up from what Rahul said, till the time the public doesn't make a political party win or lose an election, making healthcare as a basis for that, nothing's going to change. Because this feeling of distrust, the public partner always feels that the private guy is here to make money. They cannot believe that you may be running for loss years on end and still running a show just because you committed to doing it. It's beyond their imagination, even when they have the numbers with them, even when they are collecting the money. So this distrust, and when you look at, these polls are conducted and people are asked, what do you think is most important for you in your life? There'll be terrorism, there'll be this, there'll be that, and healthcare will be 2% or something like that. So why will the politicians even attempt to address it? There may be that individual person who wants to do something.
So, if we had to send a rocket into space or a satellite into space or invest in nuclear technology or power, should we take, where money is scarce, should we take our money and put it there? Or should we do primary health for our people and our countrymen? If you had a choice, if you were the Prime Minister, what would you do?
There's no doubt it has to be prevention of disease, which is with clean water, toilets, cleanliness all around, which will prevent, as Dr. Wanda said, a huge amount of communicable diseases, and primary health care. We have, if you see the infrastructure that our forefathers developed for us in this country, it is brilliant.
So you're saying we shouldn't do the liver transplants for
we should also do it. We should also do it.
Let's first clean up our, our water, our primary health, talk to people about NCDs.
See, we cannot ignore the highest in terms of technology areas. Those need to be there. And that's where the private sector has concentrated, because you cannot make things, ends meet when you go to the primary centers, unless, even if the government were to fund private healthcare with the amount of money they are spending on the PHCs, if they say we spend 1 crore per PHC and that's what we are going to give you, go and make it run, I'm sure it'll run. But here the thing is that they want to have their cake and eat it too. You're supposed to be doing everything at a fraction of the cost, and you are supposed to get the best possible equipment under the sun, specs which are made by the government, and at the end of it, you're open to RTIs, you're open to all kinds of rules and regulations, which one doesn't mind if you're doing a good job. But at the final end, they'll say, what is in it for the government? This is when it's a honest, this is when it's an honest endeavor. Otherwise, the guy on the ground is going to say, what is in it for me, under the table. So it's very tough. It's a utopian thought, as was being said just now. Theoretically, it is the way to go. But when people who are sitting in offices and making policy, they may have the best intentions and they make, a good project, but when it comes down to ground level implementation, it saps you. It saps you.
So what we're hearing is that we have to meet problems halfway, midway maybe, and implementations are an issue. I was actually saving the best for the end. I have great admiration for what has happened with Obamacare. And, a lot of good things have been done. More people have access to healthcare. Maybe they're learnings from your country. Maybe we should learn better to work together between the public sector and the private sector. Maybe more quality work. So, Joe, I'd just like your thoughts.
Well, this is a political season in the U.S., and I'm sure you've all heard about it, so I don't even want to go there. There's two comments, though, I want to make. One is the conversation about general care for the general population of India. It clearly has to be led by the government because it's such a massive amount of population. But what's clear to me after living here now for 5 years is that the government has to not only partner with the privates, but they have to learn about execution from the privates, okay? The private healthcare sector has done wonderful things here, okay? There's no dearth of talent, there's no dearth of technology. What people have done at Apollo and Max and all these places, you talk about liver transplant, the talent is here, the technology is here as good as the rest of the world, right? And so what India has been able to do through their private, for-profit healthcare system is raise the level of the lake to say it can be done, okay? What government has to do now for the general population is partner with these privates and actually let the privates do the execution, okay? And the private health, and they need to be reimbursed for that, right? No government, I don't care where it is capable of doing anything in terms of execution, whether it's in the US or whether it's in Canada or whether it's in India. But here, you have a willing, privately, for-profit hospitals and institutions that need to get involved with the government on the execution side of taking care of the general population.
So we
Sorry,
do
Preetha,
have to work together.
I'm also going to make a comment. Completely agree. I think there are different filters of segregation of roles, and I think it's unclear at the moment what that is. And let me explain. There are some quarters which say that, okay, you know what, leave primary care to the government and secondary and tertiary care to private hospitals and private providers. There is another segmentation, which says, do you want to be a provider or a payer, or both? And to your point, what you're saying, John, is that in many cases, the governments have realized that being a provider is very expensive and inefficient for themselves to do. So become a payer and become a crafty payer who understands the economics that go, so that the private sector can actually participate in the execution and the provision for a reimbursement which makes sense for that particular segment of population that's being served. And if there is a subsidy involved, then so be it. But at least don't compromise efficiency. Because in most cases, the private provider knows how to be efficient and profitable. And the government usually doesn't. So that's one more nuance.
Dr. Mahajan, if I had to vote for you to become the Union Health Minister and give you 60 days in office, what were the three things you would do to make a huge difference to say that India is like the best country for healthcare?
Before replying, I would say health ministers usually have to be dragged to their office. You know, they want something else. No one wants to be health minister
but
of the
you're
country.
a doctor and you've made a difference.
And that's a pity, you know.
Too bad, you've got the job. Now answer the question.
See, I would actually make a robust public-private model, because that's the only way that healthcare is going to get delivered. Already infrastructure may be crumbling, is there, right from the large medical colleges to the district hospitals, to the CHCs, to the PHCs, to even the tiny clinics in a cluster of villages. They're all there. They're dysfunctional. How do we make them functional? You can, and how much money is being spent is there for everyone to see. I think at the district level and maybe even at the CHC level, you could involve the private sector, give them a certain amount of underwritten money, which they are going to get, so as to achieve break-even. We do that when we do a private partnership. I mean, I'm going to talk about that as well. And maybe at the PHC level, which is really at the village level, you would want to empower the people on the ground and see, because there is also a shortage of manpower. You have to, realize that. So that is one thing I would do. Second, again, in that same kind of mode, I would, go whole hog on skilling, because there's a huge, lack of trained manpower. I would also, somehow want to upgrade both my government medical colleges, which get the best talent, which has written a fair exam and got in, but there's very little infrastructure there, and the private medical colleges, which many of them do have the infrastructure, but the admission process is suspect, and hence who's getting in and becoming a doctor, what is his motivation level, what is he ultimately wanting to do in life, are suspect. And also I would see, that students from the rural sector also have some kind of reservation. And they will get in only if, because mostly everyone wants to come to this city. And so would these doctors when they get out, that they have to go back. There's some kind of thing.
You.
And also I would talk to the, if possible, with the municipalities of the 6,000 towns in India and the many villages, to see at least that the cleanliness and the clean water, for which I think hundreds and thousands of crores are spent on paper, that it actually gets spent. If we could do that, I think maybe in the next 10 to 15 years, you would be able to address
If you join
something.
politics, I'll vote for you.
Actually,
Dr. Singh,
you're trying to make him the Prime Minister. I would say you make me the Finance Minister, because that's what he was saying everybody wants to be in.
In fact, I had another question, that if you were the head of MCI, what would you do? Would you change it? Because all these issues were cropping up.
Yeah. MCI, we can discuss, but can I just discuss what he was? Yeah.
Of course.
See, in terms of healthcare, how much are we spending on health? That's the biggest issue. We just discussed management, how to kind of collaborate and how to bring about all the forces so that we all work in one direction. But unless there is money, and you know better than me, since you're a health administrator, I'm just a physician and a cardiologist. Now, unless you have money, how will they spend 17% of their GDP on health. Most Scandinavian countries spend 11 to 12% of their GDP on health. And India spends one of the least, actually. We just spend about 4% of our GDP on health. And that too, almost 70% of that comes from the private sector. The government only spends 1.05% or something on health. So unless there is, look at the wide diversity. One country is spending 17%. Average, we belong to the BRICS countries, the developing countries that we are, India, Brazil, China, South Africa. And if we look at those countries also, they spend 7 to 8%. So unless there is money, which the government puts in, and of course the private sector is putting it in a big way, how will things change, as I was saying, in the primary care? Because the private sector is not going to go to the villages. The government is not ready to put in. So if you are a minister, if there is, and education and health, believe you me, are the two things which will be, even from politics, since one of the words written is politics in our discussion. Even politically, it will be a very wise thing. Sometimes I just think that if education and health somebody spends upon, we were just discussing this missile issue, I don't think this can get votes. But if some politician spends money on health and education, which are the basic needs of any parents for their children, I'm sure politically it's going to be a very wise decision, and they might reap benefits of that political decision.
Joe, any inputs on how, maybe an outsider view on how we can do it? Spend more money on education and health and up the budgets in that area?
Yeah, from my perspective, it starts at the caregiver level, right? So your medical colleges, influencing young people, young bright people, to go down that path, right? And whether that's subsidies for the medical colleges or making the medical colleges better, I don't know exactly how that works, but for me, that's where it all starts. And then there has to be opportunity then for those graduates. Clearly, from a volume perspective, there is. I mean, India is way underserved when it comes to healthcare professionals. So that'd be number one. Number two, spending in the rural communities is a must because of all of the needs that there are and the dearth of facilities. But it goes back to the first point that Rahul was talking about, and that is, how do you best execute that, right? You best execute that through the for-profits. And the one thing that I believe the government has to get away from is that the for-profits making money is a bad thing. It's actually a really good thing because they don't take it all home. They reinvest in themselves, as Apollo did, and they do transplants, right? And Max is doing the same thing. To me, those are the two areas of spending where the government can be most effective, at the front end and at the back end.
Thank you. We have exactly 10 minutes for questions before we wrap up. Maybe three questions. Can we go to the audience? Feel free to direct it to any one of our esteemed panelists. Go ahead, some gentleman in the center.
Good afternoon. My name is Dipankar. I'm part of the Hero Group. I think we have had a great discussion on the macro economic aspect of healthcare in India. Now, as an end user, we talked about the profitability and the efficiency of the private players in the healthcare sector. My question is, as an end user, sometimes one gets the feeling that the spelling of hypocritic the I has been replaced with a Y, because doctors seem to have revenue targets, and the way the end user is dealt with, it's not really from a healthcare perspective, but from a profit maximization perspective. So I think that's pretty harmful for healthcare system in India, and as well as a tourist destination, from a health tourist destination from a global standpoint. So I think that's a concern, and there should be some structural remedies in place to address that situation, because large hospitals and large healthcare systems are becoming very common. They are very, very important, of course. They are critical, and I hope that is an exception and not the rule. But the commercialization is rampant, and there should be systemic checks over there. Thank you.
Yeah, I agree with you, and I think there will always be, this is not a monochromatic kind of behavior pattern. You will find extremes, you will find middle of the road, but the more evolved institutions, and I can certainly speak for many people sitting on this panel, the more evolved institutions have realized that, at the end of the day, you have to graduate by reconciling and aligning values, integrity, and how you actually treat patient and patient experiences. And if you don't do that, and you take a very commercial view on a per patient basis, you will eventually lose the game, although you might gain in a few years. So I think most people have sort of realized that and moved on. I believe also that the profit maximization, to the point that was made earlier, is never a bad thing. I can tell you, profit maximization for commercial organizations which have stakeholders and shareholders is like any other obligation that you have to that shareholder. But if profit maximization comes from margins, comes from cost efficiencies, comes from delivery efficiencies, comes from synergies, comes from thoughtful implementation of technologies where outreach is maximized or costs are reduced, those become the hallmarks. The third piece that I would mention is that under the leadership of Preetha, in the Nat Health platform that we have, we did attempt to create at least a self-regulating mechanism, a code of ethics, if you will, which really all of us sort of put together saying, okay, this is a charter that we should try to achieve. Now, no one can promise that there is 100% or even a 50% compliance to it, but at least being mindful of that is a very important direction. And I believe that I think most evolved organizations are going to get there.
Actually, I'd like to take up this, because this is the real question which comes to the mind of any end user. I would say the Indian system of medicine is one of the best, actually, if you look at from the end user's point of view. It might be expensive, but it does leave a lot of choice within you. As an end user, you can go to any physician. You can go to today Max, you can go to Apollo, you can go to, if you're in Ludhiana, you can come to the Anand Medical College, you can go to any other institution. So, and what happens is self-auditing happens, because when a patient goes to multiple places, the patient ultimately gets the best advice. And just as in any other profession, people who are successful, people who are riding high, like Dr. Harsh Mahajan or somebody, they would obviously be doing the best because intra-profession auditing is happening. If his radiology setup is giving reports and I as a physician am sending my patients, if I will get competent reports, I will at the back of any physician's mind, patient getting well is the most important thing. So let's not mix up ethics with profit making. Profit making is a separate issue. And I don't work in a for-profit institution. Mine is a not-for, but I still feel profit making is nothing bad. But being unethical, doing procedures that are not right, doing investigations that are not required, that is unethical, that needs to be audited. And I somehow feel in Indian system that does not exist to the extent, it's more of a media hype. And it's more of a fear that has crept into the minds of the people. So that kind of feeling of being together, the traditional Indian value system, where the physicians were held as kind of their family members, kind of their do-gooders, there is an erosion on that. As physicians, we need to do a lot. We are conscious of that. But unless we keep up with that, our traditional Indian pattern of medicine will be corroded, and we will have issues. The cost of medicine will obviously go up once this gets corroded.
If there's a vast difference between Indian healthcare and the US healthcare system, it's that you all know what you're paying for. In the US, it's all driven, as most of you probably know, by insurance. So the insurance company tells me where to go, where to get my procedure. And at the end of the day, the end bill is, I'm blind to it because I pay my insurance premiums and they do it. The point that Dr. Singh brings up is critical. We all up here run institutions where the consumer shops for their value, as you should. And it's a consumer-driven industry here in India, which is a very good thing, because you know where that rupee is going and you know where what's being paid for. So as we evolve as private institutions, right, we'll compete and we have to be better, okay, than the alternative. And that's going to be driven by the consumerism from all of you out there.
Thank you. We have just one more question,
Preetha,
exactly
if I could
2 minutes.
Preetha,
and then...
if I could just...
Oh, all right. Can you ask the question, then you say what you want to, and maybe answer that. Yeah.
The question is for Dr. Mahajan, right?
Okay.
Okay, forgive me. My name is Baba Steve. I'm from United States. I've been living there for 45 years. Reference to medical system, as he said.
We have exactly a minute, sir. Okay. What's your question?
The question is, what you said is right, but that how to manage this and how to put the policies together. And that is where they're running a problem. How you can implement it, because we may think that this is a democratic country, and United States is a democratic country, but indirectly, the United States is not a democratic. It's a dictatorship, because every person is responsible and is given by the Social Security. You do wrong, you be paid. You have to pay for the punishment. And that is the problem we are running here. So how do you solve that? That's what the question is.
See, about commercialization of medicine. Yeah. About commercialization of medicine, I think it's overhyped. When you get in technology, which, you know, you have swank hospitals, you have capital intensive equipment coming in. Ultimately, it has to be paid for. And that's where the costs have gone up. It's no longer someone is just feeling the pulse, giving you medicine. None of you would be happy with that. You want to know what is going on. This is the age of evidence-based medicine. So with that, you know, if you have to know, you have to use technology, and that's where the costs go up. But even with that, I would not compare with the West, where at times you may be paying 50 times for a thing that is done in Apollo or Max here. But even if we were to compare India with Nepal, Bangladesh, Sri Lanka, and Pakistan, we are 30 to 50% cheaper than these countries for all procedures. When you compare the so-called costliest of hospitals, it's just that we don't factor in this expense in our day-to-day, life. And that's why when it suddenly hits, it seems so wrong.
Thank
so
you.
I think if we trust, things will be great. And it's out of trust that 70, 80% you get well also. The medicines only work about 20%.
There's one more thing which I think is very important. Just because, let's take two institutions, public and private. Let's assume that the bill in the public institution is 1,000 rupees and the bill in the private institution is 1,500 rupees. Now, so the accusation always is, hey, the private institution is very expensive and there's a problem here because these guys are making money hand over fist. The fact of the matter is that the cost of waste and inefficiency in a lot of the public institutions, and obviously there are notable exceptions, but we all know that there is infrastructure lying there which the government has already spent money on. It is lying empty, disused, poorly used, inefficiently used. The first thing that we need to do is not spend one more rupee, but actually reutilize the existing infrastructure that has been invested in for years and decades and create, to Dr. Mahajan's point, a viable public-private partnership platform where something like this can actually happen and the execution of this can be taken up by the providers rather than the government. To me, I think that would be the one single thing that will move the dial.
Thank you. I think healthcare as a topic, we could have gone on for 2 days. We had 40 minutes, and what has come out of it is that I think the private sector, the not-for-profit sector, and the government has to find ways and means to work together. The devil is in the details. We don't have answers about how do we execute on these great, on our dreams, but we can execute and achieve if we work together, and I think that came out very clearly. There's a sense of a bit of mistrust between the private sector and the public sector, and I think we have to work very hard to overcome that. The key issue here is that, we were talking about budget allocations. Right now, 40,000 crores is what the budget allocation is. Just a back of the envelope calculation that if 50% of our 1.3 billion population could be, if we could make them spend 1 rupee a day towards some sort of insurance or a cess on healthcare, that would be 19,000 crores. Almost 20, which is half the healthcare budget, which would again take the budget up by 2 points. And so we would have more money in the kitty to give more access, to build more infrastructure. So that's something which, we should start talking about, thinking about for the future. We never spoke about, the IT and how that can be revolutionary. I feel bad because Vanita is sitting in front of me, and I know IBM has some fantastic solutions. So we probably have to save that good thing for another session at another time. But ladies and gentlemen, it's a huge topic. It's a huge responsibility, and we must never forget the fact that education and healthcare is the fundamental right of every citizen of this country. How do we achieve it? How do we make things better? How do we heal not only India and the rest of the world? I don't think we'll ever have answers overnight, but I think it's a gradual movement. As a country, we've come a long way, but we know the road is long and ahead, And it's deliberations and interactions like this which really make that difference, which make that change. And I'm hoping for a brighter and a healthier future for all of us. So gentlemen, thanks for being such wonderful panelists. I really wish we had more time to, get all your points of view. But having said that, thank you all for being there as part of this.
Thank you, ladies and gentlemen. I would request Mr. Chandan Chaudhary to kindly grace the stage and present a Thanksgiving memento from our side to the esteemed group of panelists. First and foremost, Ms. Preetha Reddy. Can we have a round of applause, please? Up next, Mr. Harsh Mahajan. देखिए तालियां बजती रहनी चाहिए. Dr. Harsh Mahajan. Mr. Joseph A. Nicholas. Come on, it's health related. The more you clap, your blood pressure will be fine. Dr. Gurpreet Wonder. And Mr. Rahul Khosla.